Hi, my name is John Crowley. I'm a physical therapist here at Champion Fitness Physical Therapy, and I'm here to talk to you today about alternate methods for spinal decompression and mobilizing the spine. In healthy individuals, the spine gets its nourishment through compression and decompression. During the day, when we're standing, we get compression in the spine, which causes fluid migration between each one of these segments and a general loss of height in the disc. At night, we get restoration of that height through decompression when the spine is unloaded. In an unhealthy spine, this cycle of compression-decompression is generally interrupted. And what we get is a loss of disc height and a loss of fluid in these discs and a loss of height in these other little joints in the spine, these facet joints. What we do with spinal decompression, aquatic therapy, and unweighted treadmill traction is try to restore not only that disc height, but that motion and thus fluid absorption within these tissues. Using a treadmill traction unit and a standard unweighing harness, we can serve to decompress the spine, thus allowing fluid into the discs and those other small joints in the spine. And also utilize a treadmill for restoring motion in the spine with it decompressed. Doing this alleviates pain, increases motion, and generally supports better function within the spine. This is Tessa Arndt. She's a PTA student from Illinois Central College. She's going to be our demonstrator in the treadmill traction unit. Disconnect you from this for a second. Turn the face. The harness will typically attach slightly below the ribs. We'll tighten it down to a snug fit, and this will provide, when we lift her up, the unloading in the lumbar spine. Components in this device are a scale that lets us gauge exactly how much weight we're pulling. And for Tessa, we're going to pull about 50 pounds starting off. Good. Okay. Treadmill traction can successfully be used to treat disorders of the spine, including degenerative disc disease, herniations in the spine, spinal stenosis, knee osteoarthritis, ankle injuries, and other disorders of the spine or lower extremities affected through degeneration or just generally through pain. Number one advantage of treadmill traction is that it's a much more functional activity than spinal decompression or ambulation in an aquatic environment, because we spend most of our day up walking around on our own 2 feet. This particular unit allows us to grade the level of decompression that we put through either the spine or the legs. Therefore, we can facilitate a progression towards normal function in lowering the unit down a little bit, thus increasing the amount of weight we put through either the spine or the legs. This is the only unit that we have in Champion so far, and it's available here at Bloomington Champion Fitness Physical Therapy.